Yeah, these are nice times to remember. But I think we're joined now by Professor Kofi Amegah. He's an associate professor of environmental and nutritional epidemiology. He's a project lead on Breathe Accra project at the Department of Biomedical Sciences at the University of Cape Coast. Prof, good morning to you.
Good morning, sir.
Thank you so much for making the time. We're really hoping you can help us understand a few things. First of all, I mean, the Harmattan is raging, and we're hearing from the EPA and other, institutions that is a big contributor to the pollution. But surely that's not all there is in there, right? The Harmattan is a wind from the Sahara. It blows over several countries before it gets here. So if we are the worst polluted, there must be something else in there, right? Can you educate us on the content of the pollution here in Accra?
Yeah. Anyway, I like the way you have situated everything in context. So certainly at this period we are in the Harmattan season. So as you rightly pointed out, there is a dry dust that is brewing across West Africa, and certainly also contributing to the air pollution levels we are seeing. But there are other things that we are doing in our space that is leading to what we are seeing. So there are a number of sources of air pollution in the city of Accra and other urban areas of Ghana. Vehicle emissions is the first thing.
Right.
We have everybody is driving a vehicle these days to work. Yeah. Besides vehicle emissions, we also have open burning. People are burning indiscriminately their waste because we have poor waste management practices, and also the waste collection agencies are not up to tax. Then you also have the domestic cooking, where we are using charcoal and wood to cook because LPG is expensive and beyond the rates of domestic users. You also have these young guys out there who, because they are in the city in search of better livelihood, are now riding Okada. Okada has taken over the Accra landscape. So these are a number of other contributing factors to what we are seeing currently.
So these things, I mean, obviously they've existed for some time. I mean, long before the Harmattan came along. Does this mean that Accra was actually quite heavily polluted before Harmattan?
Possibly yes, because we don't have the data to showcase the extent of air pollution in the city. Not until recently that some data started becoming available. EPA has the mandate to monitor air quality in the Ghana space, but they have challenges. They used to have some equipment that they were using which were very obsolete. Now, courtesy of the World Bank and US EPA, is being replaced, and now they have real-time air quality monitors that they are using. So now in real time, we are able to know the air pollution levels. That is the more reason why now it's become a topical issue. So previously we didn't have the data because we don't have the monitors. And even the limited data that was being collected by EPA was not real-time data. Right. So they collect the data and then they analyze and later on they showcase it. But now we are getting real-time air quality data. And the project that I also lead has also deployed a number of sensors in Accra. We have about 60 sensors in Accra. And on a real-time basis, we are able to know the air quality levels. And that is the more reason why it's become a topical issue now.
Right. So if I stand in the middle of Accra right now and I breathe in, educate us. What exactly am I allowing into my body and what effect will it have on me?
So you are breathing in a cocktail of air pollutants, ranging from particulate matter, and we have the very finest one, which are the ultra-fine particles, or the PM2.5. And these are very small particles, less than a strand of hair. And as a result of that, they can penetrate very deep into the bloodstream and can cause a lot of havoc. So cardiovascular diseases, respiratory diseases. So air pollution has been linked to a spectrum of health outcomes, including some weird outcomes like even depression and mental illnesses.
Wow.
Yeah. So you are breathing in particulate matter. You are also breathing in NO2, nitrogen dioxide, which is from the diesel trucks. And there's a lot of construction going on in Accra. You have in Accra Central, you have all these trucks bringing in the rice and oils, and they are always idling. So you are breathing in a cocktail of air pollutant, which include PM, which include NO2, and even carbon monoxide.
Okay, what do these things do to the human body? What kind of, you've mentioned cardiovascular disease, respiratory disease, but these things are dangerous. Do they cause cancer, for example?
Oh yeah, it causes lung cancer. And there is empirical evidence, not from our settings here, but from Europe and North America, where they have been monitoring air quality for a long time, and they have one of the most advanced air quality monitoring systems. There is data from very rigorous designs, and what I mean by rigorous designs are longitudinal cohort studies that have linked air pollution with all the outcomes that you can think about. Just mention them, and then we can show you the evidence. So it's linked with cancer, it's linked with hypertension, linked with diabetes, and then importantly, exacerbation of asthma. So there are some vulnerable populations. So the vulnerable groups are those who have underlying conditions. So they are hypertensive, they are diabetic, they have respiratory conditions like asthma, rhinitis, and then you also have children. You have elderly people, and then you have pregnant women. So air pollution has been linked with a host of health outcomes. But you see, the problem here is that, my brother, it's a silent killer, and nobody dies, and then we say the person was killed by air pollution. So there's only one person in this world who has air pollution listed on her death certificate. And this was a young lady who was suffering from asthma. They were living around the South Circular Road. And then there were a number of exacerbations of asthma. The young girl later died. The mom, who is a Ghanaian, decided to leave the campaign because she became aware that air pollution could be the cause of the asthma exacerbation. And finally, the coroner came to a conclusion that air pollution was the cause of death, and that was listed on the death certificate. So that is the only thing that we have, and that is the more reason why we are not seeing any effort on the part of government or local government to address the air pollution issues that we have, because we don't have the health evidence.
Now, if you just joined us, we're talking to Professor Kofi Amegah from the University of Cape Coast. He's an associate professor of environmental and nutritional epidemiology. He's helping us understand what this air pollution thing does to our bodies, and he'll also be helping us with what we can do to perhaps reduce the effects. But Prof, before we get to that, another thing, here in Accra especially, there are almost no green spaces. Forests are supposed to be like air filters, like the lungs of the earth, to help purify our air. Well, we are constructing buildings on every single square inch of Accra. We are losing our green cover. How is that also contributing to the very high numbers that we are registering today?
I like the way you put it. I think you are well versed in these things. This forest cover serves as the lungs. So they filter the air pollution. If you are talking in terms of climate change, they serve as a sink, the carbon sinks. So if we are losing all these green spaces, then of course we are on a tangent where at some point we'll be hit by anything that the environment can throw to us. So it's important that we also have some green cover. But you see, as you said, Accra is expanding. All the green cover is being depleted for infrastructural development. But we need to also ensure that there are some tree planting around. We also need to leave some of the cover. Once upon a time, we heard about Achimota Forest and all those stuff. It's important that we maintain these green spaces, which are more like the sink or the lungs for the city.
So if nothing changes, first of all, let's start talking about solutions. If nothing changes and this continues, what will happen? What will be the immediate effect on residents of Accra and surrounding areas? What will we start to see? Yeah.
Yeah, so you know what? Every year there is an institute in the US and then also the WHO. They try to quantify the burden of disease that is attributable to air pollution. So what we call the global burden of disease studies. And the figures that come out for Africa is very dire, you know. So it means something has to be done. There has to be a solution. But the reason why we are not trying to find solutions is because what is the number of deaths that is attributable to air pollution that the health service itself is fully aware? Are we counting any deaths? Are we surveying for deaths or illnesses attributable to air pollution? If we are doing that, just as we are doing for malaria, HIV, tuberculosis, then of course there will be some sustained action. There will be some sustained action. Because routinely in the health service, we are not doing any surveillance for air pollution related diseases, even though we know it's killing people. You know, so that should be the start. We need to get the data. And once we get the data and then we show the data to the policymakers, then of course there will be some investment to address the air pollution situation. Right. So if we don't do anything, air pollution obviously is killing people. But as I indicated, nobody has it listed on their birth certificate. In a year, in the African region, it's been estimated by the WHO that 1 million people are dying every year as a result of exposure to air pollution. So this is huge. Something has to be done about it.
Okay. Well, so what would, if government were to, you know, pick up the phone and call you and ask for your advice, what do we do? Where do we start to solve this problem? What would you say to them?
So the starting point is that we need to improve our public bus transport system. We used to have Ayalolo. What has become of Ayalolo? Because we are talking about emissions, vehicular emissions. And if you want to reduce the vehicular emissions, then we need to get people to keep their cars at home and then join the public bus, as we see in Europe and North America. You know, these trotros that are on our roads are one of the most polluting fleets. There has to be a reason for them to change to cars that are less polluting, to electric cars. So to address the vehicular emission side of things, this is what government could do. The other thing is that we need to encourage active travel. And what I mean by active travel is that we need to encourage people to walk. We need to encourage people to ride bicycles, to work, and then also to the market centers. But where is the infrastructure for that? If you want to encourage people to walk, there has to be sidewalks where they can walk and not walking in the middle of the street and also jeopardize their life. If you want to encourage people to cycle to work, there has to be dedicated cycling lanes. But these things can be done. I mean, if we are doing road infrastructure in Accra or in Kumasi, we can incorporate cycling lanes into there. All our sidewalks has been taken over by street vendors. And this is where the local authority comes in. They need to make sure that we free these sidewalks of these street vendors so that people can walk. And you see, when you are engaged in this active travel, there is also a public health co-benefit. Your physical activity levels is improved, and then your cardiovascular benefit, there is cardiovascular benefit as a result of that. Then the final advice that I can give is that as a people, we need to improve our nutrition. These air pollutants are free radicals. So if you are taking in foods that are very high in antioxidant vitamins and minerals, like fruit and vegetables and the nuts, then that can also more or less attack the free radicals, and we don't see the ravaging effect of this air pollution in the body.
Right.
Yeah, so this is an advice that I can give if the government picks a phone call and call.
Now, there are calls for us to wear nose masks and so forth during this time. Is that helpful? And what else can we do in addition to that? You've already talked about eating healthier, foods, fruits and nuts. But what else? What else can we do?
Yeah, that is also one of the advice that we need to stick to. But what our advice is that you first need to know the air pollution level in the location where you are. So, for example, if the air pollution around the enclave of Joy FM is that bad, then you step out and then you wear a nose mask. But you don't wear a nose mask for the sake of wearing a nose mask. And then also we have to try and avoid polluted areas. And data from our monitoring network has been able to identify some of the polluted places in Accra, Madina Zongo Junction, for example, Agbebloshi, the Makola area. So the advice that we give to the most vulnerable population, like street vendors, outdoor workers, like police officers, and commuters, is that if you find yourself in these polluted enclaves, then it's advisable that you wear a nose mask. If you have to avoid those places, you have to.
Right.
Yes.
Well, we're talking to Professor Kofi Amegah of the University of Cape Coast. He's a professor of environmental and nutritional epidemiology. He's the project lead for something called Breathe Accra project. So obviously he knows a lot about pollution here in Accra. He's with the Department of Biomedical Sciences, and he will give us even more when we come back from these messages. Stay with us.
On air.
Your morning radio.
You're welcome back. It's the Super Morning Show on Joy, and we're talking about air quality here in Accra. There's a website called IQ Air, which is a global air monitoring website. They have stations across the capital in Kwashiman, at Kwashiman Junction, at the Department of Physics, University of Ghana. They have several monitoring stations there. They have one at the U.S. Embassy in Accra. About 6 or 7 monitoring stations across the capital, and they are recording a current what they call USAQI. That's the unit of measurement of 336. That is ranked as hazardous. Okay, it is 57.2 times the WHO annual air quality guideline value. 57.2 times more dangerous than the highest level of pollution accepted by the WHO. Okay, it's not looking good. And in fact, the content of the pollution is also listed. They say you will find finely ground silica dust along with gravel and other forms of ultrafine or coarse particles. You will find black carbon and volatile organic compounds or VOCs, as well as, and they are coming from a multitude of combustion-based pollution sources, ranging from cars to factories and even the open burning of trash and refuse. Other pollutants that are also worth noting due to their danger are ones such as mercury, lead, cadmium, along with polycyclic aromatic hydrocarbons, dioxins, and furans. These are some of the main pollutants you find in Accra today. Our guest, Professor Kofi Amegah, an associate professor of environmental and nutritional epidemiology and project lead at Breathe Accra project with the Department of Biomedical Sciences at the University of Cape Coast, has been educating us. But we are joined by Professor Paul Osei Sampene. He's a pathologist and medical coordinator at KNUST. Prof, good morning. Thank you for making the time.
Good morning, my brother. How are you too?
Very well, thank you. Now, Prof. Amegah, you'll be very interested in this because you raised the concern of lack of data about deaths caused by pollution. Well, that's why Prof. Osei Sampene has joined us. Because, Prof, apparently, we do know something about those who are dying from air pollution in Ghana, don't we?
Yeah. Good morning once again, and my greetings to Prof. Amegah.
Good morning, Prof.
Yeah. Well, like you rightly said, that what you call air pollution is one of the main causes of death, except that you don't have, as it were, we don't have data to back them. There is data, and as usual, Ghana, what we do is that those of us in academia, when we do our research and the results is given, unfortunately, those who live outside of Ghana, especially those from the northern part of America and then what do you call it, Europe, they are the ones who rather take our data, analyze it, and then probably use them. Back home, we don't use it. We don't need them. Because I personally have done even a lot of autopsies around Obuasi especially those places where gold mine is one of the main land people. The dust is well polluted with asbestosis, do you understand? Asbestos. So you do autopsies and you do take samples of the lungs, and it becomes clear. You see all these particulate matters in their lungs. Go to what you call Pristia, Bogoso, all those places. In fact, all the places where mining is the main source of livelihood, those pollutants are there. And so therefore, the data is there, except that people are not interested in using it. People are not even looking at it as anything, because as you rightly said, in Ghana, people do a lot of knee-jerk reaction. The case comes and everybody talks about it, and after some time, it goes down and that's it.
Okay. Now, Professor Sampene, I mean, you've talked about mining areas, and Kojo earlier was talking about, the source of the pollutants, and he talked about lead and others. Now that you've mentioned this, help us understand how these metals contribute to air pollution and their own effects on us.
Well, we inhale. Inhalation is one of them. Mm-hmm. And sometimes ingestion of it, that's eating the pollutants mixed with foods. And then sometimes, drinking from these waters that have also been contaminated. For instance, if you have air pollution problem in Accra, you don't only have to look at it in Accra, but you see, air doesn't have any boundary. They travel everywhere. Probably somebody may come from, let's say, Obuasi, where probably he has worked in the mines for some time, and he has this particulate in his dress or something. So he comes out. It's something that is theory, actually, but it's possible. So we have to be actually looking at it in a manner that it's a whole country, not only Accra. It's a whole country issue where pollution is one of the things that we don't usually see as a problem. We inhale them, we ingest them, and sometimes we refuse them. And that's where the problem is.
Talking about the data, and I'm just interested in how widespread this is. And so, based on your research, how many people estimated?
Well, I haven't done personally. I have not done any work in terms of putting the data to publish a paper. Okay. But I've come across doing a lot of autopsies around these places where these particulate matters are found in people's lungs. So, like I'm saying, it is there, except that probably there's no lack of, there's nothing like collaborative work to see the need for us to get them together and then make a publication out of it. So as to the data, it is there. If somebody dies from asthma, everybody knows that asthma is actually exacerbated as a result of some of these particulates. Gain is fine particulate, or these particulate matter, these are very big ones. And then let's say tuberculosis. In as much as tuberculosis can also be caused by some of these mycobacterium, they can also be caused by any other form of particulate matter. You understand? And then we talk about so many other upper respiratory tract infections, and then other underlying diseases that we know. So it is there. Except that probably the pathologist who does such an autopsy will say that the thing is air pollutant that he inhaled. But it is clear that if somebody had died from asbestosis, it is clear that it's a pollutant that has killed the person.
So, Prof, when you cut open, a body, when you're doing an autopsy, and this is a person who has died from air pollution, what are the signs? What do you see in there that tells you that this is what caused his death?
Sometimes grossly, it becomes very difficult to grossly determine. And so you have to process the sample and probably put it under the microscope, and then you see them. At times, if the person has accumulated a lot more, then sometimes in cutting grossly, you may get some brittle sort of reaction as the knife goes through the lungs and goes through those organs. The knife sometimes can encounter some resistance there. And then you take the sample and do further tests, essentially histological tests, and then it comes out that the person had a lot of these particulate matter, especially the metallic one. I'm talking about heavy metals.
Yeah.
You see some of them in there, and then you conclude that this is the situation that the person died. But it's interesting, most of them, they do that, especially those who are working in the mining sector. Especially, I'm talking about the established mining centers like Obuasi gold mines and all those things. They do that to establish the fact that the person has died so that they go in for workman compensation.
Right.
Otherwise, most of them dying, they don't even want to do autopsy on the bodies. That's the reason why sometimes we miss some of these data and makes it very difficult to work with it.
Yeah. So, Prof. Amegah, if I may bring you back in. I mean, I think it's true that, it is difficult to get accurate data for some of the reasons Prof. Sampene has outlined. The fact that we don't actually tend to do as many autopsies, as perhaps we should. But there is some data, as he has demonstrated. How helpful is that? What can we do with what we have, Prof. Amegah?
Yeah, I mean, I think the data that Prof has highlighted are the case reports. They do the autopsies, they are seeing these things in the lungs. So it more or less affirms what I earlier indicated, that air pollution causes havoc to the human body in terms of being deposited in the lungs and deep into the bloodstream. So what happens is that there has to be some public awareness. I mean, these pathologies that are cutting these cadavers, they need to put this evidence out there in the mainstream so that people are aware that air pollution is causing havoc to the body, and then we can act to protect ourselves. But, we can't sit around and be throwing our hands around. Let's face it, there's evidence from Europe and North America that has linked pollution to a spectrum of outcomes, as I indicated. I bet the levels that they are seeing there are very low levels. And even as a result of that, the WHO recently have revised their guidelines such that the guidelines level now is 5 microgram meter cube per year annually compared to the 15 previously. So something has to be done about the whole situation. And I'm glad a professor has come in and indicated this is what we are seeing in the facilities. And certainly that goes to allude to the point that we need to do something about it.
Now, Professor Amegah, before we wrap it up, there are those who say that, for many people, some people who say that, what we are experiencing is because of the Harmattan, and that once the rains come, like we would say in Ghana, we'll be fine. Is that the case?
You see, the levels that we see during the dry season are certainly higher, especially season are certainly higher than the wet season. Because, of course, when the rains come, they are going to douse these pollutants. Kojo raised the issue about also we having a green cover that can serve as a sink for the city and filter these pollutants. But notwithstanding, you see, the issues, the causes of air pollution are still with us. So even if the rain comes in, and as I indicated now, you see, when WHO revised their guidelines, it means these guidelines are done based on empirical evidence. So they have assembled studies, and they have realized that even at levels 5 micrograms per meter cube can still cause havoc to the body. And what are we seeing in Accra? We are seeing 50 plus. So even when the rain comes, we will still be above the WHO threshold. So the steps is that we need to address the pollution sources. And so we cannot just say, once the rains come or once the Harmattan ends, the air pollution problem is gone. It's not gone. It's still with us. Kwejo indicated that, does it mean that previously Accra was polluted? And I say yes. Previously, we did not have the data. But now data is becoming available. You highlighted the IQA website where they have sensors across the world. And the sensor in Kwashima is a sensor that we put there for them to contribute to their initiative. So we cannot just say once the rain starts coming, the air pollution problem is gone. Not at all. It's still with us.
Well, On that foreboding note, I want to say a big thank you to our two guests. We've been hearing from Professor Kofi Amegah, Associate Professor of Environmental and Nutritional Epidemiology. He's the project lead for Breathe Accra project, and he's with the Department of Biomedical Sciences at the University of Cape Coast. We also heard from Professor Paul Sampene. He's a pathologist and medical coordinator at KNUST. He, of course, revealed that autopsies are actually telling us that Ghanaians are dying from air pollution. We thank you both so much for your time. We really appreciate it. Well, look, do you know what? The more I listen to this, the more I wonder, why has this never come up as a campaign a campaign issue? Why have we never asked politicians, what is your plan to clean up our air? Our capital is the most polluted city in the world. What is your plan to clean up our air? Because you see, look, look at how agitated we are about Galamsey. How upset we are that our water bodies are being polluted, that our forests are being depleted. We've lost 38 forest reserves. It concerns us, it bothers us. But you know what? If your water is polluted, you still have the option of importing water. You cannot import air. There's nothing you can do if your air is ruined. So we really need to hold their feet to the fire and ask them, what is your plan to clean up the air? It's our only option. We have to clean it up. And look, we are cutting down forest reserves. We are allowing people to go and mine in forest reserves. We are allowing people to destroy our water bodies. We are allowing people to burn all kinds of carcinogens in the atmosphere that are causing us illnesses. We are doing all this, but we are charging the average Ghanaian an emission fee, an emission tax. We are charging Ghanaians money, and the money is not going to solve the problem.
You know, reading from the IQ Air, data, it tells you one thing. There's even lead, for instance, and that's
God!
And Professor Sampene is also, corroborated that. It tells you one thing, and look, and he's talked about in mining areas, for instance, you mentioned cadmium and others, which are actually polluting the environment. And Professor Sampene has talked about how you see samples of these when you conduct autopsies on persons who have died. This is it for me. When we started having this conversation in the morning, there were a lot of people who said, it's because of the Harmattan. It's actually how we rubbish things in this country. Okay, so all of a sudden we said, it was the Harmattan, it was going to go away. It's the Harmattan, it was going to go away. You heard from, Professor Sampene telling you that in certain areas, it's not just the Harmattan. He's actually talking about the fact that let it not even be a conversation about Accra. And we'll be reading some of your messages. People who have sent us messages and have said, in this part of the country, the air is equally polluted. That's what we feel. However, that this has not become a major issue. Yes, we would all take the blame because we've also not talked about it the most, but we're talking about it today. And this must become a major issue because gradually we're destroying our environment and just do not care. Last time, and you asked a question about, the trees that would serve as filters. That would serve as filters. Recently, I saw somebody advertising an estate and someone commented on it on Facebook. That person said, why is it that many of you, when you build estates, have no trees? You have just pavements.
No green spaces at all.
Today, in this country, when you want to buy a piece of land, the land on which there are trees is less expensive than the land where the trees have been cleared. Unfortunately, I love to be at the countryside all the time because the greens, even though the weather is dry, at least you feel relieved.
You breathe fresh air, actual fresh air.
This is the point. And it is not just because of the dryness of the weather. We burn anyhow. We burn things anyhow. I mean, wait for the rains to come, and people would just, gather their rubbish and then light it up, and that's the end of it. They're burning it. Where it's good that the Greater Accra Regional Minister was able to get people out of Agbogboshi. E-waste, for instance, burning of it was a major problem.
Yeah.
Destroying the environment.
That place, long before this, Agbogboshi was the most polluted place in the world.
Exactly. So, look, this is a serious matter. Let us not play our usual politics with it, and let us not play our usual, the rains will come with it. Enough. He's told us some of the areas, most polluted areas, Medina, that area, Zongo Junction, that area. In case you're going to go to that place, please mask up.
Yeah.
It's very important.
Yeah. And let's start asking our politicians questions. Government of Ghana, EPA, Ministry of Environment, Science, Technology and Innovation, Ministry of Lands and Natural Resources. What is your actual strategy to solve this problem? What is your actual plan? Don't tell us the rains will come. Don't give us that third world answer. Let us think our way out of our problems.
So,
we'll be back.
Before we go,
messages.
We've got lots of them, Kojo, but there's one here at Gideon Mauto. Now, listen to this carefully. No factories, no industrialization, but we managed to beat Delhi in India. How? This is a serious public health situation, and authorities must act now.
Yeah.
So pay attention to this. No factories, no industrialization, but we still managed to beat Delhi.
We don't have forest fires like California. We don't have volcanoes spewing out volcanic ash like Iceland. We don't have any of the things that have put other countries on that list. But we are number one, and we are almost double the pollution levels of number 2.
Let me get into more of your messages. At Nans_down says that the figures are interesting because the margin between us and the second polluted city is so wide. Adousu Samuel is asking a question. He says, what are the factors the Prof considered before saying people should ride bicycles? Well, because he had talked about how, the emissions from our vehicles.
Yes.
Particularly, also because a lot of us, drive, second-hand vehicles, some of which the engines are very old, so the emissions, itself are polluted, and so it becomes a problem for us.
Yeah.
And then at Abdul_ himself says, this happens to a country where their leaders are much concerned about fattening their accounts every 4 years and neglecting the importance of environmental sustainability. Do we have environmental engineers, scientists, etc.? If yes, how much is allocated for it? Who cares? At Emperor Wayne says, these nations have hundreds of factories employing millions. We have nothing, yet we have the audacity to be filthy and polluting too. Admakumi says, we're ranked over India. Do you know how wild that is?